Brilinta, a powerful medication used to prevent blood clots and reduce the risk of heart attack or stroke, has gained significant attention in recent years. But what exactly are the benefits and potential side effects of this popular drug? In this video, we unveil the truth about Brilinta and provide you with an in-depth exploration of its benefits and risks. Benefits of Brilinta. Brilinta, also known by its generic name ticagrelor, is an antiplatelet medication that works by preventing blood platelets from sticking together and forming clots that can block blood vessels. Numerous studies have shown the benefits of Brilinta in reducing the chances of a heart attack or stroke in patients with acute coronary syndrome. One of the key benefits of Brilinta is its ability to provide rapid and consistent platelet inhibition. Unlike other antiplatelet medications, Brilinta achieves its maximum effect within 2 hours of administration and maintains its efficacy for up to 24 hours. This means that patients can experience a consistent level of protection against blood clots throughout the day, reducing the risk of cardiovascular events. Another advantage of Brilinta is its proven ability to lower the risk of heart-related death in individuals with a history of heart attack or peripheral artery disease. A clinical trial called PEGASUS-TIMI 54 demonstrated that patients who took Brilinta along with aspirin had a significantly lower risk of cardiovascular death, heart attack, or stroke compared to those who took a placebo. In addition to its effectiveness in preventing cardiovascular events, Brilinta has also been found to improve outcomes following coronary stent placement. Research has shown that Brilinta, when used in combination with aspirin, reduces the risk of stent thrombosis and the need for repeat interventions, leading to better long-term outcomes for patients. Despite these benefits, it's crucial to consider the potential side effects of Brilinta before deciding to incorporate it into your treatment plan. Common side effects of Brilinta. Like any medication, Brilinta comes with its share of potential side effects. Some of the common side effects reported by patients taking Brilinta include bleeding, shortness of breath, dizziness, and headaches. Bleeding is perhaps the most notable side effect of Brilinta. While it is expected for an antiplatelet medication to increase the risk of bleeding, patients taking Brilinta may experience bleeding that is more severe and prolonged compared to other similar medications. This can manifest as nosebleeds, bleeding gums, or in more serious cases, gastrointestinal bleeding or hemorrhagic stroke. It's important for patients to be aware of this risk and report any unusual bleeding to their healthcare provider. Shortness of breath and dizziness are other common side effects that have been reported by some Brilinta users. These symptoms are more likely to occur in the initial weeks of treatment and usually subside over time as the body adjusts to the medication. However, if these side effects persist or worsen, it is important to seek medical attention. Headaches are another side effect that has been associated with Brilinta. While headaches can be bothersome, they are usually mild and transient. If headaches become severe or persistent, it is recommended to consult a healthcare professional to rule out any underlying causes. It's worth noting that not all patients will experience these side effects, and for many, the benefits of Brilinta outweigh the potential risks. However, it's essential to be aware of these common side effects and monitor for any changes while taking this medication. Rare side effects of Brilinta. In addition to the common side effects mentioned earlier, there are also rare but potentially serious side effects associated with Brilinta. These side effects include severe allergic reactions, such as rash, itching, swelling, or difficulty breathing. If any of these symptoms occur, immediate medical attention should be sought. Another rare side effect of Brilinta is the development of a condition called angioedema, which involves swelling of the face, lips, tongue, or throat. Angioedema can be life-threatening and requires immediate medical intervention. Some patients may also experience an irregular heartbeat known as atrial fibrillation while taking Brilinta. Although this side effect is uncommon, it is important to be aware of the signs and symptoms, which may include palpitations, dizziness, or shortness of breath. If any of these symptoms occur, medical advice should be sought promptly. It's crucial to remember that while these rare side effects may occur, the overall incidence is low. The benefits of Brilinta in preventing serious cardiovascular events often outweigh the potential risks. However, it's important to discuss any concerns or unusual symptoms with a healthcare professional. Brilinta dosage and administration. The dosage of Brilinta may vary depending on the individual's condition and other factors. It is typically prescribed as a loading dose followed by a maintenance dose. The loading dose is usually 180 mg and is administered orally. This initial dose is crucial for achieving the desired antiplatelet effect quickly. Following the loading dose, a maintenance dose of 90 mg is taken twice daily. It's important to adhere to the prescribed dosage and schedule as directed by a healthcare professional. Brilinta should be taken with a low-dose aspirin, typically 75,100 mg per day, unless contraindicated. Aspirin helps enhance the antiplatelet effect of Brilinta and further reduces the risk of blood clots. It's important to consult with a healthcare provider about the appropriate dose and duration of aspirin therapy when taking Brilinta. Precautions and warnings when taking Brilinta. As with any medication, there are certain precautions and warnings to be aware of when taking Brilinta. Individuals with a history of bleeding disorders, such as peptic ulcers or intracranial hemorrhage, should exercise caution when considering Brilinta. The increased risk of bleeding associated with this medication may outweigh the potential benefits in these cases. Patients who are scheduled for surgery or dental procedures should inform their healthcare provider about their use of Brilinta. The medication may need to be temporarily interrupted to reduce the risk of excessive bleeding during these procedures. It's crucial to follow the guidance of healthcare professionals regarding the management of Brilinta therapy in such situations. Brilinta may interact with certain medications, including other antiplatelet drugs, blood thinners, and certain antidepressants. It's important to inform healthcare providers about all medications, including over-the-counter drugs and supplements, to ensure there are no potential interactions that could increase the risk of bleeding or reduce the efficacy of Brilinta. Interactions with other medications. Brilinta has known interactions with medications that affect the liver enzyme CYP3A4, which is responsible for metabolizing many drugs. Medications such as ketoconazole, clarithromycin, and certain HIV protease inhibitors may increase the blood levels of Brilinta, potentially leading to an increased risk of side effects. It's important to inform healthcare providers about all medications being taken to avoid any potential drug interactions. Similarly, Brilinta may also interact with medications that affect the platelet function, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and certain selective serotonin reuptake inhibitors, SSRIs. These interactions can increase the risk of bleeding and should be taken into consideration when prescribing or taking Brilinta. It's crucial to consult with a healthcare professional to ensure there are no potential interactions between Brilinta and any other medications being taken. Alternative medications to Brilinta. While Brilinta is an effective medication for preventing blood clots and reducing the risk of heart attack or stroke, there are alternative medications available that may be suitable for certain individuals. One alternative to Brilinta is clopidogrel, which is another antiplatelet medication commonly used in the management of cardiovascular conditions. Clopidogrel has been extensively studied and has shown efficacy in reducing the risk of cardiovascular events. However, it may have a slower onset of action compared to Brilinta and may require a higher loading dose to achieve the desired antiplatelet effect. Another alternative to Brilinta is prasugrel, which is also an antiplatelet medication used in the prevention of blood clots. Prasugrel has been shown to be more potent than clopidogrel in terms of its antiplatelet effect. However, it is associated with a higher risk of bleeding and is generally reserved for patients at higher risk of cardiovascular events. The choice of medication will depend on the individual's specific condition, risk factors, and any contraindications or potential drug interactions. It's important to consult with a healthcare professional to determine the most appropriate medication for each individual. Personal experiences with Brilinta. Personal experiences with Brilinta can vary from person to person. While some individuals may have positive experiences and benefit from the medication's efficacy in preventing cardiovascular events, others may experience side effects or find alternative medications more suitable for their needs. It's important to remember that personal experiences should not be the sole basis for making treatment decisions. Each individual's situation is unique, and consulting with a healthcare professional is crucial in determining the most appropriate treatment plan. Conclusion: weighing the benefits and side effects of Brilinta. Brilinta, or ticagrelor, is a powerful medication that has demonstrated significant benefits in preventing blood clots and reducing the risk of heart attack or stroke. Its ability to provide rapid and consistent platelet inhibition sets it apart from other antiplatelet medications. However, it's important to consider the potential side effects of Brilinta, such as bleeding, shortness of breath, dizziness, and headaches. While these side effects can occur, the overall incidence is low, and for many patients, the benefits of Brilinta outweigh the potential risks. Ultimately, the decision to use Brilinta or any other medication should be made in consultation with a healthcare professional, taking into consideration the individual's specific condition, risk factors, and potential drug interactions. By understanding both the benefits and side effects of Brilinta, individuals can make informed decisions about their treatment plan and work closely with their healthcare team to achieve optimal cardiovascular health. Thanks for watching.